Our track at ICASA is Track B, and it's called Clinical Sciences, Treatment and Care. And this, as the name implies, it's focusing on the science of HIV and also the aspects relating to treatment and care. Here we'll be looking at different aspects and different categories or treatment groups of patients, looking at children, issues around adolescents, and of course adults as well. We will also be in our track looking at issues around what are called comorbidities. These are particularly non-communicable diseases which are now featuring fairly prominently as patients on treatment live longer. So we are looking at cardiovascular diseases, that means diseases of the heart and circulation. We are looking at renal disease, diseases of the kidneys, and of course some cases of cancer, both HIV-associated and non-HIV-associated cancers. In our track, we had in excess of 255 abstracts that were submitted, and out of those we have selected about 207 that will then feature at the conference. Of these, 46 are going to be oral abstracts. That means abstracts that are going to be presented in an auditorium setting. The rest of the abstracts, that's the remainder, which is 162, will now be poster presentations. And the posters will be presented on different days together with posters from the other tracks on the different days throughout. The major, just to give just an insight into some of the issues that are featuring, the issues of treatment, the issues of monitoring, how to, the 90-90, which WHO is advocating for. How do we get people to be on treatment, to maintain them on treatment, and hopefully achieve viral suppression among them. There are presentations that are focusing on issues of treatment failure and issues of tracking of patients as well. So there are quite a whole range and variety of presentations in the track. We do have a scoring system that was used, and our duty now is to select those with the highest scores and allocate them to the different sessions that we have. We will have 6 or 7 sessions of the oral abstracts, each with at least 6 presentations. So the criteria is based on the scoring, but we also want consciously trying to balance the abstracts. That means that we have a broader sort of representation of issues that I've highlighted, issues of children, issues of adolescents and adults. But also try and have remember this is an African conference, so we must portray the African perspective of the conference, thus have the regional representation, because we are supposed to learn from one another. So issues, people that are working in the East African, in the West African, the Francophone, in the Anglophone regions, and Southern Africa, where we are, we should be sharing. So we try and get abstracts, of course, which scored high from the different regions of the continent. We have done a lot of work within the short space of time, trying to do justice to science, trying to do justice to the expectations of our delegates, so that they have got robust research to look forward to. And definitely we have gone all out to make sure that the good take-home messages for the practitioners that come, and there will be something for everyone, for the up-and-coming researchers, for those involved in clinical work, but also those who are involved in public health issues and advocacy issues, and we have got something for everyone. And we are looking forward to this being a very exciting track as part of the whole ICASA conference.